Dr. Kathy McFarland.
And I'm Mark Bobo, and welcome to the OSBA Forum. As always, we are delighted to bring the OSBA Forum to you. Your association continues to be committed to keeping you informed of the happenings within public education. Today's topic, however, does go beyond the walls of our schools. Today we're talking about mental health, from awareness to strategies to strengthen our mental health. When we're talking about mental health, it includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And Kathy, we're really excited to have some guests today that'll really help us understand the importance of mental health.
Yes. Thank you, Mark. And yes, we are so pleased to welcome Director LeeAnne Cornyn and Chief Advisor Tia Marcel Moretti from the Ohio Department of Mental Health and Addiction Services. Throughout LeeAnne's career, she has worked tirelessly on behalf of Ohio's most vulnerable populations, children and those living with mental illness and substance use disorder. She was appointed by Governor Mike DeWine in December of 23 to serve as director of the Ohio Department of Mental Health and Addiction Services. Before her appointment, she served as Governor DeWine's Deputy Chief of Staff, where her duties included oversight of the health, mental health, human services, education, and children's issues policy portfolio. Ooh. That's a day job.
Oh, yeah.
LeeAnne has also served as a Director of Cabinet Affairs, where she acted as a liaison between the governor and his 26 state agency directors. Also an educator, LeeAnne taught 8th grade science in Los Angeles and as a Teach for America Corps member. Welcome. We also would like to welcome Tia, who is the Chief Advisor at the Ohio Department of Mental Health and Addiction Services. She serves as the department's Deputy Director of the Office of Family and Community Resiliency. Most recently, she was the founder and CEO of the Ohio Institute for Substance Use Disorder Excellence, a nonprofit trade organization focused on quality outcomes in addiction treatment. Formerly the Assistant Vice President of Behavioral Health Integration for CareSource, Tia is a licensed social worker and Ohio certified prevention consultant who has worked in the community-based mental health and addiction space for 25 years. She knows what she's talking about.
Yes, indeed.
Director Cornyn and Chief Advisor Moretti, welcome to the OSBA Forum. Wow.
Yeah.
Wow.
Yeah.
I am so excited to have you here and to be speaking on such an important topic.
Indeed.
All right, here we go. So for the members who may not be familiar with the Department of Mental Health and Addiction Services, can you tell us a little bit about this department and the work that you do?
Sure. So at Ohio MAS, which is what we call the Department of Mental Health and Addiction Services for short, we do a lot more than meets the eye. In fact, when I came here about 6 months ago, I was honestly surprised and learned some new things that the department does because it is so wide and complex, some of the work that we do. So most people are probably familiar with us as the state entity that helps create policies and priorities for the behavioral health field. A lot of the time, we do that by passing financial resources down to our 50 local ADAMH boards, some of which your members may have experience partnering and working with, especially on the prevention front. But in addition to that, we also operate 6 state psychiatric hospitals that serve more than 1,000 patients on any given day. We also help run statewide campaigns to address stigma, educate Ohioans about resources like 988, our suicide and crisis lifeline. And we also help to regulate more than 2,300 behavioral health care providers across the state. So we do a whole host of different things. And I think why that's so important is because Governor DeWine has put such an incredible spotlight on the behavioral health field. We knew from the work that we were doing in partnership in the Attorney General's office, we knew a lot about opioid addiction and the challenges that our communities were facing at that point in time. But we know that post-pandemic, those substance use disorder challenges and those mental health challenges have only increased. And I think Tia's going to be talking about some of those trends in a minute. But we are just deeply honored to represent the department and be here and do this work. The governor frequently says that it's his goal that every Ohioan has the opportunity to live up to their full God-given potential. And I certainly know that education is a key component of that. But we also know it means removing barriers for Ohioans so that they can succeed. And for a lot of Ohioans, that means access to mental health treatment or substance use disorder treatment. And we have less than 1,000 days at this point to help build the system that was never built. So we're excited to be here to talk about it.
And I love the fact that she used the word barriers, because
That's
we
right.
often speak to our board members about if your kids are not coming to school or if they're not graduating, what is the barrier? And so often it has to do with their mental health. So exciting. Thank you.
Tia, let me ask you, we hear from our board members and school leaders about how it seems like in our buildings, our students are exhibiting greater mental health challenges than ever before. I think we all can acknowledge even the pandemic exacerbated it in our buildings. What trends are you seeing at the state level in regards to mental health behaviors?
Well, unfortunately, I have to validate what they seem like is increasing. So while the data is staggering and heartbreaking, it's great opportunity. It's going to shift the tide in the fact that we all can have a role in helping create healthy communities. Your members are likely very familiar with our Oh Yes survey, and it's been an incredible tool. It's how we're able to kind of incrementally see where we need to shift tools and resources. But there's been a 2/3 increase just through our Oh Yes data of young people reporting that they sense, experience, or have a need, a mental health need so great that it warrants intervention. That's profound. These are young people's voice reflected in our data and our surveys, and they're saying and able to identify. So the good in that is that we've done so much with stigma that young people have language and an ability to articulate. The bad news is our kids are sad, depressed, and without resources, or feeling without resources. Our Ohio Youth Risk Behavior Survey, which is conducted through ODH, kind of compounds that even further, with 42% of high schoolers reporting feeling sad consistently for 2 weeks or more over a year-long period. Sad, hopeless, despondent. That's overwhelming, and imagining kind of having to learn, be in a space while that many of us in a classroom are grappling with these feelings of worthlessness and sadness. And it's compounded even further when we look at our death data. Unfortunately, 1,800 young people have committed or completed suicide. And I'm going to just pause a second there. The highest rate or cause of death for kiddos 10 to 14 years old is suicide.
When you gather this data, when they say, I'm sad, I feel helpless, do you dig deeper down into that data to say why? Where is that coming from? How did this start?
I'm going to say yes and no. Like the tool, and director, help me if I miss anything here, but the tool in the survey, it's taken years to come to a place where we can accept it with stigma as it is. Right? And I think that our young people being brave enough to participate in it and take it, we have to be very careful when we start asking why, not because we don't want to know, but because incrementally in reducing stigma. Imagine the fear of saying, yes, I have felt sad and depressed. I've thought about taking my life for 2 weeks straight, at least one time this year, and now having to write down to identify why. There certainly are targeted questions around what might be the driver, but getting to really the heart of what you're asking in your question, I think is going to take a lot more work on all of our parts to be able to find the words and feel safe saying them. And sometimes, as we've all experienced, we don't know why we feel depressed. We're inundated with images and the barriers at home and community.
I will say, and interrupt you, as a former building principal, even when I go into buildings today, that stigma, it's actually, it doesn't seem to exist among our young people. They are, the ones that I have experienced have been very open about how they feel and their wellness. And so, when I grew up, you don't talk about that stuff. You don't talk about that stuff. And so I am happy that a lot of our schools are embracing our students and providing.
It does seem like our students are more open to talk about it in safe spaces. But what can some of our schools do to kind of help prevent some of these behavioral health challenges that we're seeing?
Well, I think I'll start with cell phone policies in schools. Certainly you've heard Director Dakin, the governor and lieutenant governor speak a lot to this. And I know just last week, the governor, along with Lieutenant Governor Husted and the Department of Education and Workforce, issued their draft policy that schools could adopt on cell phones. we know, and I had the great opportunity to sit on a panel and hear from schools in Dublin earlier this spring with the director and the governor and lieutenant governor. And the messages we hear from school board members and superintendents and building leaders is that when you take the phones out of schools, the laughter that reemerges in the cafeteria, the focus that they're getting in their classrooms, the reduction in and stress and anxiety and kids coming to the nurse's office with stomach aches and, you know, the interpersonal issues that they're seeing from a disciplinary standpoint. So we know that that can go miles because that connection, that community connection is reignited. We know that based on a recent Pew survey, almost every single young person has access to a cell phone. Half of them almost are using it almost constantly. And nearly half of them, when they are using it, admit using it as a tool to avoid interaction with their peers. And if you're using that to avoid interaction, and you're not interacting with your peers and your community, we know that that can have profound impacts on the mental health and well-being of our young people. So that's one strategy that we really hope school districts start to employ within their student bodies. But I know Tia has a lot of thoughts on prevention tools that may be available for communities as well.
I mean, we have tons of resources to tap into. One we have to tell is Sources of Strength, an evidence-based curriculum that looks at coping, resiliency, and seeks to prevent suicide. Sources of Strength will be very familiar with your members because it's in over 340 schools and serving 146,000 kiddos.
And how do our members find this?
Well, they can find that on our website at OMOS, and also through Sources of Strength, and through our other partner agencies such as your local ADAM board will have listing, and Prevention Action Alliance is a nonprofit that has a listing of a lot of our resources. We also tell PACs. It's a favorite for the director and I both, right? Both of us being fans of the power of regulation and the investments we've put into the various toolkits of PACs in schools that we've partnered with Nationwide Children's Hospital to make that accessible, easy to look up as well in terms of PACs and Nationwide Children's Hospital, but creating a climate that is safe to learn in, where I understand how to regulate myself as a teacher, and I also understand how to help my kiddos and my students regulate as well. A couple other ones I just wanted to mention is I am a huge fan of youth-led prevention. The power of youth-led prevention. Coming up myself as, I guess, a troubled youth that had my own experiences as an adult, being exposed to evidence-based youth-led prevention, which again is available through organizations like Youth to Youth International and is funded by us to the local ADAM boards. These activities and this structure takes place primarily after school. There's camp opportunities, but their young people get to understand critical planning in communities, and they get to participate in the change and the necessary leadership skills and durability skills to help them have those interpersonal interactions without phones and really create power and change in the legislature, change in their communities. And a couple others is that we invest heavily in the Miami School-Based Center of Excellence. This is born to be a resource for your teachers, your administrators, on how to identify what works in the classroom, what works out of the classroom, and the entire staff at that Center of Excellence is dedicated to providing supports to your members. So those are just a few. Director, did I miss any?
No.
No, I was just going to say, I really love the youth-led prevention.
Me too. We can go all day.
But allowing the children to be part of the healing process versus it being put upon them. I think that's really important.
And they accidentally learn amazing leadership skills along the way.
Yeah.
Can you speak about the 988? I know that the instead of 911, the 988. We've talked about that before, but I want to make sure that our members are aware of that.
Yeah, absolutely. So 988 is Ohio's relatively new crisis and suicide lifeline. So it is 24/7, completely confidential, totally free of charge. Anyone can call, and within about 30 seconds in the state of Ohio, be connected to a real life person here in Ohio near your community who can, one, help just talk through the challenges that individuals are facing, whether that is thoughts of suicide or whether it's just dealing with life and all that life is throwing at us. So those individuals that are behind the headsets, they are put through very rigorous training to be able to help de-escalate situations, help people locate resources. If needed, they can dispatch mobile response, which is a non-police response to that person's location. Or if that person might be a threat to themselves or others, then they can send in 911 as a last case scenario. So it's an incredible resource for Ohioans that is now totally statewide, regardless of where a person lives, they have access to 988. And one thing that I'll add, since we've been talking a lot about youth-led prevention, on our website, mha.ohio.gov, we just launched, I think a week and a half ago, a materials generator. So folks can go on there, they can find different avatars, different slogans, all completely vetted and check to ensure that it's non-stigmatizing, and folks can actually put their logo on these materials. They can pick, their own phrases, their own, layout, so that it can be completely unique to the population they serve, but they can co-brand it with their logo. So talk about youth-led prevention. It's a great opportunity for young people to generate content that's relevant to their peers and hopefully lead a 988 awareness campaign in their schools as well.
That's great. Yes, I appreciate you sharing that information.
Yeah.
So, LeeAnne, talk to us about how schools can help address gaps in mental health treatment.
Well, it will come as no surprise because the governor spoke to it in his State of the State address this past April. But there is immense value in school-based healthcare. We know that young people who have access to school-based healthcare have improved attendance, they have higher GPAs, better college prep, less incidents of suspension. So we know that there are incredible outcomes associated with access to healthcare in your school. And we know that so many of our districts are working to integrate not just physical health care, but also mental health care into that school-based footprint. We are very blessed at the Department of Mental Health and Addiction Services to partner with some of our local districts. Later this summer, early fall, we get to go help Springfield City Schools cut the ribbon on their new school-based healthcare facility, which we helped to finance through the last capital budget. And they are fully integrating physical and mental health care in that facility in partnership with their local federally qualified health center, Rocking Horse. We know that the governor recently just announced through the Department of Development a $64 million investment in building up school-based healthcare in 20 Appalachian counties. The Department of Health has sunk tens of millions of dollars into helping more communities build out school-based healthcare. So we know that this is a really great avenue, and there are incredible examples if folks want to take a look at the Department of Education and Workforce's most recent publication on student wellness and success. And disadvantaged pupil allocations, that there are great examples of schools that have actually built out school-based healthcare using student wellness and success. I believe it was Warren City Schools that used their student wellness and success funding to integrate school-based healthcare in every single one of their buildings, serving 1,200 kids. So it is possible to do this work even with the funding that's already been allocated.
That's awesome.
Yeah.
So let me ask to you, when you're in the school, you're really trying to focus on educating the child, but things happen. So what if a child is having a mental health issue in the school? And as an educator, I may not be able to identify it. How do you deal with that?
Well, also in the governor's State of the State, he announced his commitment to bringing what's called mobile response stabilization services, or MRSS, to every Ohioan or every young kiddo under 21 years old. So MRSS is a tool that, again, as it states, is mobile response and stabilization services. And the model is evidence-based, but it is built on a Just Go model. The caller, the family calling, or the referral source, which our number one referral source is schools. So to the exact scenario you set up, is Just Go. The family, the caller defines the crisis. Right, and it deploys a team no police unless necessary. And the whole point is to wrap that family and that child in services in their home, in their community, preventing the trauma of having to go to a hospital, having to be hospitalized, and look at what we can do for up to 14 days in the home to stabilize that family. A couple really neat things and resources for your members, specifically around MRSS, is with you being schools being the #1 referral, and the consumers or our school-age kiddos, 13 to 18 years old. We have the American Legacy Theater as a component of this. And this is a youth theater that enacts safely a scenario, can come into your school and enact a scenario in which MRSS would be appropriate to respond. And in the course of that 45 minutes, we're learning coping skills. We're also becoming aware of MRSS and how to use it as a community and as educators and as families. But also it has a little plug in there around young people potentially joining our field of behavioral health. So I would encourage a little plug, right? And another component of the MRSS work is we bring that currently in 42 counties with a commitment to go to all 88 counties, is the Hey, I'm Here campaign. So you're probably sensing a theme with me. I always find a way to tie it back to how youth can inform the design of the services and resiliency building. Hey, I'm Here is a campaign that's designed by youth with a youth advisory board that looks at generating content around resiliency and resiliency building. And many of our youth on that advisory board are families that have taken place in MRSS services.
That's really great. One of the things that we did learn kind of quickly in the building is that when the police had to be brought in is to make sure that you communicate with the police that this is a mental health crisis.
Yes.
How important that is. And so do you have information about that, or do you talk about?
So we, as a State Department, spend a significant amount of money actually partnering with our law enforcement partners to educate them on crisis intervention training so that they understand de-escalation strategies. So when individuals do call and say, this is a mental health crisis, hopefully they can deploy that CIT trained law enforcement officer to the scene so that individual isn't escalating, because sometimes law enforcement response can cause somebody in a mental health crisis to further escalate. So we've trained tens of thousands of these law enforcement officers across the state, so they really are an amazing resource and asset, not just to our schools, but to our communities in general.
And you had said something that triggered a question. The healthcare profession, we talk a lot about the teacher pipeline. Do we have enough great people in your field to support
You'll hear a common theme from Tia and I, and we're so blessed that we have a governor that is so focused on kids and mental health. In his State of the State, he kind of gave a call to action to our institutions of higher education to really double down on their commitment to investing in the behavioral health pipeline. We know that we need hundreds of new psychiatrists. We need thousands of counselors. We need thousands of social workers by the end of the decade, right? Just like we need thousands of probably new teachers.
Right.
So one of the strategies that we're employing at the Department of Mental Health and Addiction Services is our Great Minds Fellowship. So this was an $85 million investment that we were able to secure in a previous General Assembly, and we're using that to provide young people who are completing 4-year degrees in social work, a variety of social work and nursing pathways. They can get up to a $10,000 scholarship if they go into the community-based behavioral health field, and we have enough resources to support 4,000 of these new folks going into the community-based behavioral health field. I will say we only have 400 enrolled right now. So if any of our school board members have children or know people pursuing, degrees in social work or psychiatric nursing, this is a great opportunity. Push that information out. But we also have 3 university partners that are working to develop curriculum to educate high school students about opportunities in the behavioral health field. So Wright State University and a partnership between Bowling Green State University and University of Toledo. So more to come for folks in those general areas soon.
Great.
Yeah, we were talking about the home situations, and we're honest. Sometimes our children go to some very challenging situations, and you mentioned the MRSS assistance that's there. But are there more support resources that are available to help our families in the home situations?
So again, when we created Student Wellness and Success back in 2019 in the governor's first operating budget, we really wanted to think holistically about all of the things that wrap around a child that can impact not just their academic performance, but their personal success long term. And one of the things that we knew we needed to do was better support schools and engaging with parents and outreach to families. Parent engagement is an eligible use in student wellness and success, and we've seen some schools do some really creative and innovative things. We've seen schools set up SEL courses for families when they know that they have a high proportion of foreign language speaking students in their community. We've seen schools hire parent ambassadors. We've seen schools use some of those resources to do parent engagement and education nights so they can bring families in to understand the curriculum that their students are learning. So there are a lot of ways. We've even seen schools use their school counselors on parent-teacher nights. So they're bringing those school counselors in to meet with families and using some of these resources that way. So that's just one avenue. We also in the state of Ohio have invested in free codes for any family with a child 0 to 12 to have a completely free training course in the Positive Parenting Program. This is an evidence-based program that just equips parents with some effective strategies to deal with all of the ages and stages and new things that come with adolescenthood, or your preteen, your kid who's transitioning into kindergarten. So we encourage all families to check out PPP, Positive Parenting Program. If they just Google Ohio PPP, that's the word triple and then the letter P, it will lead them to a link where they can get a completely free enrollment in that course. And then last but not least, we would love for all of our schools to know that there are a whole host of chapters of the National Alliance on Mental Illness all across the state. And these are folks that have lived experience with themselves or their own child experiencing mental illness. Schools can refer families to their local NAMI chapter, and that NAMI chapter can help those families deal with whatever it is that they're going through or help support them in accessing resources for their child as well.
That's really great. I had often would speak to parents who needed support, and they would say, Kathy, there's nobody available unless your child is self-harming to that level. So it's great to hear that there's so many resources out there. I just think families just don't know where to go and don't know what resources are available to them.
Well, it's often what we say in the schools, you have those interventions and levels of interventions. And if you can get in there early before it turns into something bigger, I think it makes a big difference. It makes a big difference.
Absolutely.
Is there any other things that you'd like to highlight or focus on that maybe we didn't touch upon?
So I will say 988. We would love for all of our schools to ensure that they are pushing out information on 988 to their communities, to their students. Again, we have that materials generator on our website. If folks want to host a mental health awareness night, reach out to the department. We're happy to try to send materials if we have them, or send an ambassador to come speak. We want to be here as a resource to make sure that every Ohioan knows that 988 exists. So that's first. Coach mental health training. We know that last October, pretty much most of the coaches in OHSAA sports now have to go through mental health training. One of, I think, the cool things that we are working on at the department through our Office of Innovation is working on developing potentially a curricula to bring that to Pee-wee and lower grades as well. So we think it's a great opportunity to help equip all of our coaches with the skills to recognize the signs and symptoms of mental illness. And to that end, the governor in his last budget really wanted to focus on better understanding why mental illness and substance use disorder occur. No other state is doing this, but we have invested $20 million in a longitudinal research study to work with tens of thousands of families across Ohio to do surveys, but then also brain scans and biological research studies to understand why mental illness happens, and then take some of those learnings and send them out to the field so that we can better intervene, to your point, Mark, earlier, and understand why these challenges are happening and hopefully how we can help fix them sooner. So I think that's really exciting.
That is exciting.
And hopefully it will lead to better outcomes for Ohioans. But Tia, what else would you add?
I think that obviously I have a few years, and you were so kind in mentioning them in the field. So I think that it is absolutely amazing that we have been fortunate enough to have the leadership that we do that has been so focused on this, and imagining those folks like myself who've been in the field for so long never thought a day would come that we would have this kind of attention, but we have to seize it. And here's what I'd say. I think we've done a great job on just dismantling stigma, even though we still have work to do. It's time now to demystify behavioral health, and so that people in communities understand that they can be a part of healing one another. It's our job to disseminate all the tools we shared with you. There are so many low barrier entry ways to intervene and to talk to each other. The information may not be new. We don't know. People are talking now. But what we do know is we can relate with those young people in these surveys. We've all been in a place with our mental health that probably wasn't stellar. And so I think that the thing I would add is that we have the tools available to us. We're committed to getting them out. But communities can absolutely be a part of the healing. They don't have to be afraid of behavioral health. You don't need to have a high-level degree to be able to wrap your community in love and healing in some of the evidence-based tools that we supply.
And I think that's a great point, because so often so much is put on our schools to solve the problems for their communities. And one message that I would just want to reiterate is there are so many resources that we invest in, the Department of Medicaid invests in, the Department of Education and Workforce invests in. The resources are out there. You don't have to recreate the wheel. We as the state really want to help invest in creating that continuum of care that was never built. And hopefully as a result, we'll see healthier Ohioans in future generations.
Well, LeeAnne and Tia, thank you so much for being here today. It's a vital conversation, and the expertise and information that you provided, we really appreciate it. And I know my members are going to benefit from having that information.
Thank you.
Yes, absolutely. And it makes me feel good that there's people out there that are providing resources to our families and to our children. So thank you so much for joining us today, and to our membership for your leadership in your local communities. And if there's any way that our OSBA team can help you, please, please, please contact us. We can help you find the website. We can help you find information and contact information. Just reach out to us. We are your resource, and we're here to support all the great work you do. Have a wonderful day, and thank you for being here at the OSBA Forum.